Dr. Nishant Jain. I'm Dr. Nishant Jain from Dr. Nishant Skin and Hair Clinic. Today we are going to discuss about chemical peels. So basically, what are chemical peels? Chemical peels are something which helps in removing the top layer of the skin by applying a chemical solution to the skin. It helps in making your skin look more youthful. Okay. What conditions do chemical peels treat? These are the common questions which I'll be answering. Okay, chemical peels can lessen or improve wrinkles, scars, uneven skin tone, freckles, and other skin imperfections. So basically, is chemical peel good for all skin types? Yes, chemical peels are not recommended for darker skin tone because it can result in increased darkening of the skin after treatment, or having a history of abnormal skin scarring, or having extra pigmentation in scars, and having skin conditions or medications that can cause reactions to it, and who works in lot of sunlight, and people who tend to have any kind of viral infections. So what are the steps to prepare for a chemical peel? 2 weeks before the treatment, avoid tanning or direct sunlight exposure. To prepare your skin for chemical peels, use topical products such as sunscreen, moisturizers, or some depigmenting agents which would be prescribed by your doctors. And using any retinoid cream can be prescribed before the treatment. Before the procedure, take all the prescribed antibiotics or antivirals which are usually given, and there must be no open source lesions or skin infections in the peel area. So how are chemical peels performed? A chemical peel can be performed as an outpatient procedure. The steps are very simple. First, the skin is completely cleansed with a cleansing agent, or which can help in removing the excess oil that is present on the skin. Then a chemical solution is applied to the skin. Then chemical solution typically used can be glycolic acid, salicylic acid, or TCA acid, or lactic acid, or phenol. There are different types of chemical peels that can help in giving us a controlled injury. So each type of chemical peel penetrates to the different depth of the skin, then peels away or reveals a new layer of your skin. So use of different chemical peels. So chemical peels can be light or superficial chemical peels, or medium chemical peels, and deep peels. So superficial peels, in this, the skin's outer layer is removed using a very light chemical peel. Then it is used basically to treat dryness, fine lines, acne, or uneven skin tone. Recovery may be a few days or even few hours with little or no downtime. And every 2 to 5 weeks, it can be repeated. Medium chemical peels, skin cells from the epidermis and some of the upper layers of the middle layer of the skin are removed by the medium depth peels. Wrinkles, acne scar, uneven skin tones are generally treated with this. Recovery may take a week or more than 7 days. 7 to 10 days is what it generally, and it requires some amount of downtime. Downtime, basically the skin is peeling off and it is clearly visible. A repeat procedure is needed to maintain the effect. Then deep chemical peels, it is skin cells are removed even with a deeper in the deeper layers with a deeper chemical peels with deep chemical. It is advised for precancerous growths, scars, wrinkles, and up to 8 weeks prior to the chemical peel. There are few medications that has to be followed. Recovery takes somewhere around 2 weeks to 3 weeks of time, and it can take more than that also. And repeated procedures are generally not advisable in this. With single procedures also, you tend to get a very good desired result. So what can you experience after the chemical peel? It depends upon basically what kind of a peel we are using. If it is a superficial peel or a light peel, then there might be mild redness, then mild peeling that can last from 3 days to 5 days or max to 7 days. In a medium peel, there would be redness, swelling, stinging and skin flaking that can occur up to 7 to 10 days. Swelling and all can last up to few hours, and it can reduce within 48 hours. Treated area generally take 14 days, but redness may last for few days, 2 months. In deep peel, the treatment is bandage. Bandages are removed after a few days, and the expected healing time is 14 to 21 days. Then, what are the precautions that are to be taken after the chemical peels? In light peel, as directed, you have to apply sunscreen and moisturizers until the skin heals. Once the skin is healed, then you have to apply sunscreen on daily basis, and makeup can be worn immediately after treatment from the next day itself. In the medium depth peels, you have to follow whatever the doctor's instructions have been given for you. You have to wash your face with plain water on the first day, and it should be cold water itself. After each wash, apply the ointments that have been given to you. You have to use those ointments and apply lotions or creams on daily basis. Basically, lotions and creams would be sunscreens and skin healing creams. Avoid exposure to exposing your skin to sunlight until it has completely healed. The antiviral medication must be given for 10 to 14 days only in cases who tend to have a history of herpes or any viral infections. And makeup can be worn after 5 to 7 days. In deep peels, you have to follow the doctor's instructions. You have to apply moisturizer as directed up to 14 to 21 days. And for 3 to 6 months, avoid exposing too much in the sun. Always cover your face as much as possible whenever you're going out in sun. The antiviral medication must be taken for 10 to 14 days in cases who have a history of having herpes or any viral infection. And wait for at least 14 days before applying any makeup for any kind of deeper peels. Thank you.